Hi, my name is Rebecca Nolan. I'm the CEO of Aging Best. Aging Best, formerly known as the Central Missouri Area Agency on Aging, is one of the 10 Missouri Area Agencies on Aging that cover every geographical area in the state of Missouri. Our planning and service area covers 19 counties in central and south central Missouri. So all of the area agencies on aging, there are 640 of them in the United States, 10 in Missouri, and most of us we're celebrating our 50th anniversary this year. We were created in the 70s, and the intention was to plan, develop, provide, and coordinate services at the local level. So we serve as sort of a liaison between government programs and local service providers. As soon as COVID hit, our nutrition programs were drastically impacted. Almost all senior centers closed down for congregate programming for several months, and different centers opened up at different times. But one of the things that we were able to do very quickly because of COVID funding was to offer curbside services for people. That's been expensive, and you know, our normal funding wouldn't allow that to continue. So COVID funding has allowed us to offer all of the services. We continued with curbside in certain areas and our home delivered meal. It's allowed us to continue. Now, within those programs, home delivered meals in particular, the demand for that and the need for that during COVID is just astronomically increased. And it's very expensive, and the COVID funds have helped us help the people who need it the most. And these are the most vulnerable people out there. One of our newest programs is called Aging Best on the Move. It's a mobile senior center, mobile multi-purpose senior center. It's housed in a food truck. Aging Best on the Move stands for mobile nutrition, outreach, visiting support, and education. Instead of building another senior center for people to come to, we're going to bring our services to people in areas where perhaps there's more need than the senior center can cover in that area, or perhaps in areas where there has never been a senior center. We were able to use COVID funding to purchase the food truck, and I mean, they're very expensive, and we needed to have one that would be reliable, and so that was something we never would have been able to do otherwise. So our intention is not only to bring senior center services to people in their communities and in neighborhoods where perhaps they don't have that opportunity now, but also to bring all of our services there. I would say the number one way that the COVID funding has helped us in our infrastructure is through technology. We were woefully behind in technology. We had very little. You know, we had some basic computers, but when I started, we only had one laptop, I think, in our whole agency. So we were already looking at that was something that we needed to do, but it's expensive, and these were just funds that we didn't have in the past. So we have focused a lot of our COVID funding on building a solid infrastructure to move us into the future. Our goal is, for example, with our nutrition programs, is not to just keep them running the same way they've been running since 1973, which unfortunately the funding was so flat for so long. That's really how they kept doing it the same way, but to help with new generations of people who are much more technology savvy and have different needs and different demands, to be perfectly honest, about what they expect out of a center and a program. We were able to pivot very quickly and start communicating with each other through video conferencing and different types of technology that way, and that saved us an enormous amount of money. So, you know, our geographical area is pretty large, and we used to just every week people would be driving all across the region, and now most of our meetings now are done through Teams or Zoom. So that's helped us a lot. We rely on participant contributions as a key part of our funding. And when all of the centers were closed and people were having struggles financially, our contributions have gone down significantly. So the COVID funds have literally kept a lot of the centers open during these difficult times. Some of them have bounced back very well. Some of them are still struggling to bounce back. And the COVID funds have also helped us kind of keep going. During the pandemic, we lost 90% of our volunteers. People were not able to help in ways that they had been before, but a lot of people were too afraid even to come back since then. So the COVID funds have helped us been able to keep providing the services, because we always rely on volunteers even to provide the most basic services that we have. From COVID funding that we've been able to get, not only have we been able to sustain the services that we've had in the past, but we've also had a very rare opportunity to expand some services to help people in some ways that we haven't in the past, and it's very exciting.